Welcome everyone. Today we are diving into one of the most visible and high stakes areas of EMS, bleeding and soft tissue injuries. As an EMT, your ability to rapidly identify life-threatening hemorrhage and protect the body's largest organ, the skin, can be the difference between a controlled scene and a fatality. Welcome everyone. Open and clear. So ideally we make extra space Before we grab the gauze, let's talk about what's happening under the surface. We categorize external bleeding by the vessel involved. Arterial, this is your red flag. It's bright red, oxygenated, and spurts in time with pulse. Because it's under high pressure, it won't stop on its own very easily. For venous, this is a dark maroon and flows steadily. While it doesn't spurt, a large vein can still lead to massive blood loss quickly. For capillary bleeds, think road rash. It oozes slowly and usually clots spontaneously. In the field, we follow a strict escalation of care. We don't wait and see, we intervene. Direct pressure. This is your first line of defense. Apply firm, steady pressure with a sterile dressing. If it soaks through, do not remove it. Add more layers on top to preserve any clots that have started to form. Pressure bandages. Once the bleeding is controlled, wrap it snugly. Check for a distal pulse afterwards to ensure you haven't accidentally created a tourniquet. And then we have the tourniquet. If life-threatening bleeding from an extremity doesn't stop with direct pressure, go straight to the tourniquet. Place it high and tight, or 2 to 3 inches proximal to the injury. Your pro tip, always document the time of application on the tourniquet or the patient's forehead. When the skin is breached, the clock starts ticking on infection and fluid loss. We classify these into 2 buckets. Closed injuries, the skin remains intact, but the damage is underneath. This is contusions or bruises. Cells are damaged and local bleeding occurs. Hematomas, a collection of blood at the injury site. Watch for swelling the size of a fist. That presents significant internal blood loss. Open injuries, these are abrasions. These are friction injuries or rug burn. Lacerations, these are jagged or smooth cuts. Avulsions are flaps of skin torn loose. Your treatment, if the flap is still attached back into its original position before bandaging. Punctures, these are high risk for internal damage and infection. Never remove an impaled object unless it's in the cheek or obstructing the airway. Stabilize it in place with bulky dressings. The golden hour in shock. Every soft tissue injury is a potential gateway to hypovolemic shock. If your patient is restless, has a rapid pulse, has pale, cool, clammy skin, treat for shock immediately. Keep them supine, keep them warm, prevent the trauma triad of death. Provide high flow oxygen. In conclusion, your goal is simple. Stop the bleed, prevent further contamination and transport. Master the tourniquet and the pressure dressing now so you don't have to think about it when the real call comes in.